Good afternoon, students. Welcome in HCP lecture. Today I will start the remaining part of chapter number 7. Okay. Firstly, see the what we saw in previous lecture. Shortly, okay. Introduction. In introduction, scissors. Straight blunt scissor, then straight pointed scissor, angled scissor either pointed or blunt. Then switched cutting scissor for switches, then lister bandage scissor to cut bandage. Okay, then tissue forceps. In tissue forceps, box untoothed tissue forceps and toothed tissue forceps. Okay, then next is hematostatic forceps. The other name artery forceps. For this is an incorrect name. These are used to check the blood flow from the vessel. Okay. Then towel clip or corner clip, in that Dow's type, Grace type, then Backhouse type, then Moynihan's tetra towel forceps. Okay. Then next is dissecting forceps, in that these are the used to pick up various structure or whole tissue. They are either plain or toothed. Then in that first is plain dissecting forceps, whose inner side is serrated and has a springe like handle. Then second is toothed type, which are either Million's type or Victor Bonnet type. Okay. Then next is scalpels and their blades. Okay. Then needles. In needles, mainly two types: hypodermic needles for parenterals and surgical needles, which are solid and used for switching. Okay. Then next is needle holders, then rubber catheters, then miscellaneous instrument, in that tongue holding forceps, sponges holding forceps, then bone cutting forceps, bone holding forceps, then piles holding forceps, then intestinal clamp, then laminectomy saw, that is Horsley's type. Then next is other equipment. In other equipment, ECG machine, then X-ray machine, Dopplers, echocardiography, then video monitoring, glucometer, that is blood glucose meter, then CT scanner, head, orbit. In that CT scanner, head, orbit, ear, neck, then PNS, abdomen or pelvis, then spine, extremities or joints, and 3D. Okay. Here are these are the previous lecture we have seen. Then this part we have seen in the previous lecture. Okay, so now I will start the next point is ultrasound sonography. In that, ultrasound sonography equipments which gives a sonograph of uterus are very helpful in gynecology to know the reasons of repeated abortion, then fetal conditions, then fetal abnormalities and fetal surgeries prior to birth. In ultrasound sonography equipments which gives the sonograph of uterus are very helpful in gynecology to know the reasons of repeated abortion, then fetal conditions, fetal abnormalities and fetal surgery prior to birth. Then next is magnetic resonance imaging, that is MRI. These equipments is now used in the many hospitals for diagnosis of complicated cases. The hospital equipments are now being developed on increasing scale because biomedical engineering is advancing by leaps and bounds. Okay. Then next is lithotripsy. Lithotripsy is a non-invasive technique used to break up the kidney stone by the laser beam after locating the calculi perfectly. Then the hospital have other equipment like dentist equipments or accessories, then hospital furniture and supply, then laboratory equipments and supplies, then medical disposables, then paramedical equipments and supplies, then personal medicheck kits, then personal hygiene product like antiseptic, soaps, sanitary napkins, then physical fitness equipments and medical educational aids. These are the hospital equipment. Okay, then last point of this chapter is health accessories. Okay, in health accessories, numerous health accessories are used in the hospitals for rehabilitation, restoration, and maintenance of lifestyle. These are the two types. Then, first is ambulatory aids, then bedside aids. First is health accessories are the two types. First is ambulatory aids, and second is the bedside aids. In ambulatory aids, example is wheelchair, then walkers, canes, and crutches, etc. Then in bedside aids, example is a cot with bed and swing. Then infusion bottle stand and bedside cabinet, etc. Okay. Then in wheelchairs, a chairs with wheels used for the patient unable to walk. Different type of wheelchairs are available. Wheelchairs chairs with wheels used for the patient unable to walk. A different type of wheelchairs are available. Then next is walkers, a framework used as a support by patient who cannot be walk without one, for walkers. Okay. Then canes and crutches. In that canes helps to transfer the weight of the weak limb and maintain the balance of the body. Okay. Then here are the list of the surgery, name of surgery and meaning. Okay. GIT, firstly GIT tract related surgery is gastroenterotomy. Okay. And meaning is a surgery incision into the stomach and intestine. A surgery incision into the stomach and intestine. Then next surgery is gastrectomy. Meaning is the removal of portion or the entire stomach. The removal of portion or the entire stomach. Then ostomy, meaning is a surgical procedure in which a portion of intestine or urinary tract is removed to allow the passage uh, feces or urine. Then jejunostomy, the meaning is the surgical creation of an anastomosis between the stomach and jejunum. Okay. Then appendectomy, meaning is the surgical procedure is adopted to remove the vermiform appendix. Then colostomy, meaning is in this the diversion of fecal matter stream is obtained through the opening in the column. Then cholecystectomy is meaning is a surgical procedure applied with a gel bladder. Then related to the genitourinary. Okay. First is lithotripsy, and the meaning is a procedure in which renal stone is dissolved by the laser beam. Then calpoctomy is meaning is in incision in applied to the vagina. Then aporectomy, meaning is a procedure of removal of the ovaries. Then next surgery is salpingectomy, is meaning of this is an incision of uterine tubes. Then next is vasectomy, meaning is a procedure of removal of vas deferens. Then lithotomy, meaning is it is a procedure applied for the vaginal examination in case of kidnapping. Okay. Then next surgery is oncotomy. The meaning is it is the procedure applied to surgery of the tumor. Then LASIK, that is LASIK. It is for the laser in situ keratomalacia. Okay. Then PRK, it is for meaning is photo refractive keratotomy, and the LASIK and PRK, these are the procedure applied to the correct refractor disorder for eyes. Then related to next is related to hemopoetics. First is carotid endarterectomy. Okay, and meaning is a procedure that includes the removal of atherosclerotic plaque from the carotid artery to restore the blood flow of brain. Then phlebotomy, the meaning is a procedure of removal of blood to lower the viscosity of blood of the patient, which polycythemia. Then next is the thrombectomy. The meaning is an operation to remove the blood clot from the blood vessel. Then next is related to the other systems, in that lymphadenectomy. The meaning is a procedure is adopted to remove the lymph nodes. Then last is pneumonectomy. Is a meaning of this surgery is a procedure of surgical remove of lungs, is called as pneumo, pneumonectomy. Okay, here are completed the chapter number 7. Okay, these are the important questions of this chapter. This is most important exam point of view. Okay, after watching this video, you all students are able to answer this question. Okay, I will stop here. Thank you.